everyone, my name is Grace Carroll and I'm presenting on Giardia, which is a flagellated protozoan parasite. So the items that I'll cover in this recording are Giardia, the characteristics of Giardia, the life cycle of Giardia, its pathophysiology, epidemiology and treatments, and the relevancy of Giardia. So Giardia was really first written about and drawn by a very early microbiologist in the 1600s who also worked with studying microscopy. His name was Antony van Leeuwenhoek, and he used single lens microscopes to look at mostly pond water, but one of the disgusting things that he did was he also looked at his own stool. And in his stool, one of the things that he wrote to other scientists about and described the motions of was what we now think was Giardia. He described the flagella and the motion that Giardia would take as it was moving across the lens of the microscope. And so that Giardia genus has about over 20 species because there are different species based on whatever animal that it infects. In this presentation, I'm talking about Giardia lamblia, which is also known as Giardia duodenalis and Giardia intestinalis. Giardia is as I previously said, Giardia is a parasite, specifically a gut parasite that presents mostly as diarrhea. So this is a diarrheal disease, and that disease is called giardiasis. As I'll mention in just a second, it is passed primarily through contaminated water, where cysts are found, Giardia cysts are found in that water, and so it is correlated with how well the water has been treated, if at all. And for that reason, we see Giardia infect developing countries disproportionately. The life cycle of Giardia is pretty simple. There are two basic forms of Giardia. There is, it is transmitted through the fecal-oral route. And so it begins as the giardial cyst, which is the form that is found in the environment, usually in the water. That cyst is very hardy. There's this cell wall that allows it to sort of bypass environmental or like temporal stressors. Those cysts, once they're ingested, will move into the next stage of that life cycle, which is a trophozoite stage. And that stage is what is infectious or pathogenic to humans. The cyst has 4 nuclei, which you can see on the infographic there. The cyst has 4 nuclei. It's called quadrinucleated, and once ingested, as it moves into that trophozoite stage, one quadrinucleated cyst can give rise to 2 binucleated trophozoites. These trophozoites have 4 pairs of flagella, so 8 total flagella that are then used to sort of swim through the intestinal lumen and get to where they basically are stationed for 2 to 3 weeks. Sometimes 3 weeks is the higher end of it, but they'll be stationed in the small intestine and cause infection there. At which point, at some point towards the end of the infection, the trophozoites will then be expelled through the feces, but also at some point towards the end of that infection, the trophozoites will become that cyst stage again, and there is a word to describe this that you'll see on the next page. But they'll become that cyst form again, and that's really important for their life cycle, because if they were expelled just as a trypozoite, they would not persist in the environment. So becoming that cyst again allows them to persist and allows that population, that Giardia population, to continue. All right, so there's two terms that you have to be familiar with to really understand the life cycle. Moving from the cyst stage to the trypozoite stage, this process is called excistation. And so in the image on the left, you see the trypozoite stage. On the right, you see the cyst stage. So when a human ingests the cyst, so the unflagellated image there on the right, the acids from the stomach are actually going to help it experience that excistation process. So those acids, being bathed in those acids, studies have shown are what allow it to become that infectious trypozoite. So they've evolved this mechanism to sort of not only withstand the acid, but utilize the acid to allow them to, play out their life cycle. Once they have become that trypozoite, they are going to use the flagella that they have to swim through the intestinal lumen until they get to the villous surface of the small intestine. Here, they're going to use what is in purple and labeled as adhesive disc. They're going to use these ventral discs, they're also called suckers, to attach to and adhere to the villi on the small intestine. Once they're there, there's a series of, there's a signaling pathway that occurs where the trypozoite is able to trigger enterocyte apoptosis. So basically what that means is that the parasite is able to get rid of those cells that are the absorptive cells of the small intestine. So instead of the food that you eat, instead of it being able, the fats and the carbohydrates being able to be absorbed by those enterocytes and then being passed to your bloodstream, that no longer happens. Pictures of Giardia infections actually look very similar to pictures of small intestines of people that have Crohn's disease or celiac disease. And in some cases, a doctor may think that a patient has Crohn's disease, and they go in to do a biopsy and find that they actually have this Giardia parasite instead. And so they cause this enterocyte apoptosis, which then leads to malabsorption syndrome. And then in addition, you have all of these ions that are not being, so the tight junctions in between these enterocytes are also diminished. And so instead of having ions that are going where they need to go, they're actually just staying in the small intestine. And so as you increase the solute concentration in that small intestine, you also increase the water that exists in the small intestine. And this, along with this idea that these flagella are just continually flapping back and forth, this is what leads to intestinal upset, and it's what leads to diarrhea. Obviously, like secondary effects of this are potential for dehydration. There's going to be lots and lots of weight loss, lots of bloating. The gases that are produced from this parasite, so Giardia is anaerobic, and so the metabolic pathway that it utilizes results in these byproducts that are things like methane. So lots and lots of bloating in the host due to the way that this organism is surviving. Once the at some point, the trypozoite is no longer going to be able to adhere to the small intestine. So just simply the flow of the fluid through the intestines is going to force that trypozoite to detach. When it does, it has to make sure that it has gone through this encystation process, which is the process of the trypozoite becoming moving back into that cyst stage. So that has to occur if we expect this Giardia to be successful as like a population, because remember, the trypozoites are not going to persist in the environment. It's only the cysts that are environmentally resistant. And so we have the main diagnostic tool that we have for determining if you have giardiasis is through looking at stool cultures. And so you would typically get stool cultures for multiple days, and you would look each day to see if the presence of cysts or trypozoites were there, and that would lead to a positive giardiasis diagnosis. There's also genomic testing for giardiasis, where we're looking for the presence of specific strands of the DNA from this pathogen. But this is not common. The prevalence of giardiasis, I've divided here into developing countries and developed countries, because it is much more prevalent in developing countries. 33% of people in developing countries have at some point in their life experienced giardiasis. There are not stats for how many of those cases resulted in death. However, it is important to note that diarrhea is the second leading cause of childhood deaths worldwide, and it's very, very likely that if giardiasis is more prevalent in developing countries, then part of that second leading cause of death, which is diarrhea, could be due to an infection of giardiasis in children in those countries. In developed countries, there's only been 2 deaths over the course of 10 years. So mortality rate is very low in developed countries. However, the risk factors for this disease, if you are a child, specifically 0 to 4 years of age, you're much more at risk. And this is simply because children have minimal toileting skills and they're likely to put their hands in their mouth. So somewhere between like 40 and 80% of Giardia cases fall into that age cohort of 0 to 4 years of age. Other risk factors are if you tend to be a hiker, a camper, or a backpacker, because in that case you're more likely to be drinking water or cooking with water from a stream or some freshwater source that may be contaminated with those Giardia cysts. Some of the studies suggest that even, so like preventative measures, if you're a hiker or backpacker, is that you bring along some sort of filtration system for your water, or you use like iodine tablets. And some of the studies have suggested that iodine doesn't even kill the cyst completely, and you're still at risk of Giardia, even if you think you're drinking clean water. And then lastly, obviously, if you have exposure to unclean water that is not being filtered or not being treated, this definitely increases your risk of getting Giardia. Preventative measures for Giardia would be treating your water. Some countries have, or many developed countries have really tight and stringent regulations on treating water and making sure that those Giardia cysts are not present in the water supply. But then on an individual level, making sure that you're washing your hands constantly would be a good preventative measure, as well as teaching young children to wash their hands effectively as well. Usually Giardia patients recover on their own without the need of medication. This usually is like a 10 to 15 day window where the patient would be pretty sick, but as long as they are drinking fluids, usually there is no need for medication and the patient is fine recovering without that drug. However, there are some drug options for people that have extreme cases where they are dehydrated, they are experiencing lots of weight loss, lots of bloating and abdominal cramping. And the main drug that is given to patients, it has a 90% success rate. That drug is called metronidazole, and other drugs do exist, but they tend to have lower success rates. And then as far as relevancy is concerned, I could not find much in terms of like music or arts that describes giardiasis. This is likely just because it's not that extreme of a disease and most people recover. There's like a 0 mortality rate for this disease. However, historically, there are some connections to giardiasis. So the Safe Drinking Water Act, which was in 1974, and then the Surface Water Treatment Rules, which came about underneath this Water Act, I think in 1989. These pertain to giardiasis, or Giardia cyst specifically. But in the United States, this came about because we recognized the need for ensuring that our water was clean, that it didn't have microorganisms or contaminants in the water. And so there are very stringent, very specific rules for checking for Giardia cysts, and also sort of, if they're present, how we get rid of those cysts before we transmit that water to humans. And then lastly, in Sydney, Australia in 1998, there was something called the Sydney water crisis. And this had to do with Giardia cysts, which were in their water supply, and it resulted in this episodic process where in 3 different occasions over the course of 2 months, I believe, there had to be boil water advisories passed out to the population there because there were Giardia cysts that were to the level of what they said would be in raw sewage. And so it was very, very important that people there didn't consume that water during that time. And it turns out it was just because there was tremendous flooding that year, and the one catchment that existed there didn't work given the amount of water that they had seen that season. And so this resulted in some sort of like a government authority that now exists to ensure that when something like that happens, there is it's better managed, and there's like a clear-cut stepwise process that you go through to ensure that those cysts are not in the water. And that is Giardia. Thank you very much.